So I'll begin. I like to say miigwech merci beaucoup, and thank you for joining us today for our health sciences webinar entitled The Active Approaches to Concussion Rehabilitation in Youth, delivered by Dr. Ann Hunt. I'm Jennifer DeBaker, the Health Sciences Programs and Partnership Coordinator. Before I get started, I will do some quick welcomes and introductions. So a reminder that your camera and microphone being off for this duration of the webinar. The webinar will be recorded today and it will be posted to our YouTube channel and to our website at a later date. All of our previous webinars are now on YouTube, and you can find those links to the recordings on our RS and NoDip websites, and also in the resources section on the NOSM TV channel on YouTube. We'll also have a question and answer period at the end of the webinar, so please put your questions in the chat or take yourself off of mute. So we want to start by acknowledging the land upon which NOSM is located, to raise awareness of Indigenous presence and land rights, and to acknowledge the colonial history and the current history in Ontario and Canada as a whole. The Northern Ontario School of Medicine respectfully acknowledges that the entirety of the school's wider campus of Northern Ontario is on the homelands of the First Nations and Métis peoples. The medical school buildings at Laurentian University and Lakehead University are located on the territory of the Anishinaabe Nation, specifically Atikameksheng and Wanapatea First Nation and Fort William First Nation. We humbly ask that wherever you are calling in from today, that you think about the land and areas which you reside in. So thank you, Dr. Ann. Dr. Ann Hunt is an assistant professor teaching stream in the Department of Occupational Science and Occupational Therapy, and associate member of the Rehabilitation Sciences Institute at the University of Toronto. She is also an adjunct scientist at the Bloorville Research Institute and Holland Bloorville Kids Rehabilitation Hospital. She earned her PhD at the University of Toronto in Rehabilitation Sciences and a collaborative program in neuroscience, and went on to complete a postdoctoral fellowship in the Concussion Center of Holland Bloorville Kids Rehabilitation Hospital. Anne also holds a Master's of Science in Occupational Therapy from Columbia University and Bachelor of Science in Psychology from McGill. An occupational therapist by profession, Dr. Hunt's research is focused on developing interventions that enable individuals with acquired brain injury, including concussion, to participate optimally in meaningful activities in everyday life. As a recent retired hockey mom of 3, she is particularly interested in supporting youth in recovering from concussion. So merci beaucoup, miigwech, and thank you. Dr. Hunt, thank you for your time today. We truly appreciate you sharing your knowledge with us, and we look forward to your talk. Thank you. I'll now take my screen off and let you share with us.
Thanks so much, Jen. While Jen is enabling me to share, I just want to thank you for this opportunity to join you. I'm absolutely thrilled to be here today and looking forward to this talk. And I will also acknowledge that I live and work on the land of the Huron-Wendat and the Mississaugas of the Credit, and I'm very grateful to have the opportunity to share this beautiful space today and every day. So today I'm going to be talking about approaches to concussion rehabilitation in youth, and I hope that, I hope that by the end of the talk today that you'll be able to describe the importance of some active rehab approaches to concussion recovery, that you'll understand and be able to discuss some of the practices and principles associated with active rehab, that you'll identify how you may be able to support people with concussion within your context. And I've thrown this last little one in there so that you can think about how interprofessional healthcare in your context and learners in particular, or healthcare students, could help you to support the work that you do. Before we get into the meat of the talk, I just want to really acknowledge all the people that I work with. None of the work that I do happens easily, and it's done with an enormous group of people. And these are the people that really support the things that I'm going to be talking about today. We'll acknowledge also our funders from Home Review Kids Rehab, and also Scotiabank is a big supporter of ours. So I'm going to go through a few things today, give you a little bit of an introduction to the work that we've been doing. I'm going to spend most of the time talking about our active rehabilitation programs, and wrap it up by talking about some of the practice implications, and what I think are sort of the take-home messages from the work that we've been doing. So I'm going to tell you a little bit more about myself because I think it's kind of relevant to the story that I'm going to be sharing today. You heard already that I did an undergrad at McGill, and basically, when I finished my degree there, I really didn't know what I wanted to do until my last semester there, and I heard about this profession of occupational therapy. Didn't know much about it, so I did some volunteer work and found myself at Columbia University in New York completing a Master of Science in OT. I worked as an OT in many different areas of practice prior to kind of getting into the brain injury concussion field. But once I did get into the brain injury concussion field, I was really hooked. I spent the bulk of my career as a clinician working with teens and adults who had mild to moderate traumatic brain injuries, and I was really fascinated by their recovery, and really kind of interested in how people could engage in meaningful activities despite having a lot of symptoms. So, and I also sort of, after I'd been practicing for 20 or so years, I was really, I had a lot of questions about what I was doing, first of all. And that led me to work with some researchers who were doing concussion research as the OT who was doing the interventions and research projects. And because I had so many questions, I actually ended up enrolling, when my oldest kid started high school, I enrolled in the PhD program at the Rehab Science Institute at U of T. And while I was doing my PhD, one of my kids, so you heard that I'm a hockey mom, and one of my kids had a concussion and was having trouble recovering. And so that sort of led me to chat with some of my classmates at the time, one of whom was Dr. Nick Reed, who was doing his PhD in pediatric concussion. And these active approaches to rehab were just emerging at the time. And so anyway, I'll get into a little bit more about that later, but he sort of set me up and said, hey, explore these. And anyway, this sort of my experience in that at that time, there was no information to help parents and kids. There were very little treatment intervention options for kids with concussion. And so that led me to do my postdoctoral work in concussion at the Home Review Concussion Center here in Toronto. And ultimately, I worked at Home Review for 5 years after finishing my postdoctoral fellow, and recently joined the Department of Occupational Science and Occupational Therapy at U of T, where I now support occupational therapists who or occupational therapy learners in our MSOT program. And I also have a small program of research in brain injury and concussion. So a little background information for you. So just to have some context. So I think we all know that concussion is a public health concern, and particularly in kids. And these are just some of the statistics from Ontario. So 440,000 girls and 754 boys out of 100,000 are very conservative estimates of how many kids sustain concussions per year in Ontario. And these statistics are very old. We need some new ones. So if there's anyone out there that's interested in working on some new ones, please, please, we need this. But these are considered to be really conservative estimates because many people never report that they've had a concussion. They self-treat it, or it goes to a family doctor for treatment, and these statistics don't get reported. So we suspect that it's actually quite a large public health concern. So concussion, as you know, it's an injury to the brain that's caused by a blow to the head or another part of the body. And we also know that most concussions resolve quickly. And so many of us have been taught that it's sort of 7 to 10 days, but in fact, what we're finding in youth in particular, and adults, it usually takes more like 4 weeks to resolve, and that a good um, proportion take longer. So about 30% of kids take more than 4 weeks to recover, and about 15% of adults take longer to recover. And there's been some great work done by our colleague Roger Zemek at the Children's Hospital of Eastern Ontario, where he's looked into predictors for prolonged recovery in kids. And his group has found that if you have a history of previous concussion, if you're female, if you're between the ages of 13 and 18 years old, or you have the presence of comorbidities like depression, ADHD, anxiety, sleep disorders, or migraines, that you're more likely to have a prolonged recovery. So, just to review, symptoms of concussion can be physical. They can be things like headache, fatigue, difficulty with sleep. They can be cognitive, like difficulty concentrating, and they can also be emotional. And we know that persistent concussion symptoms can have a significant impact on occupational performance. So for those of you that are not OTs in the audience, occupational performance really is a word that refers to activities and roles that we do in daily life. And we know that for kids and adults, persistent concussion symptoms can impact people's typical activities, so the engagement in school, work, social activities, and sports. And it also leads to physical deconditioning and mental health issues like anxiety and stress. And previously, when my kid was concussed, what we were told to do was to, um, sit in a dark room, in the basement, in the bedroom, with the blinds closed, away from light. Don't do any activities until your symptoms go away, at which time you could come out. As an occupational therapist, we really view that um, health and well-being is greatly impacted by our ability to engage in meaningful activities. And as a mom, I was thinking, oh, this can't be right. So that led me to explore these new approaches. And I've just kind of gone ahead with my slide here. And my concerns in particular with this old way of thinking were that the interventions that we had, putting someone in a dark room, they were focused on not doing. So they, took away meaningful activity from people, and that the mental health issues really get compounded when you take away activity, as do the physical activities as well. So the old way really didn't work very well. So just around 2009, 2010, researchers started exploring active rehab approaches. And some of the theoretical background for using more active approaches or getting people involved in activity were that activity helps to improve, or exercise is really what we're speaking about here. Is that exercise improves cortical connectivity. Moderate activity has protective benefits for cognition. So we've been hearing a lot about exercise in older people in relation to maintaining cognitive function. So it's the same sort of principles here. That exercise is associated with greater levels of brain-derived neurotropic factor, BDNF. That exercise helps to promote hippocampal volume, which we know is important for memory. It regulates the cerebral blood flow, and it's also fun to do activity or exercise. So active rehab approaches, particularly in kids, really took off when University of Buffalo, John Leddy is the primary researcher there, who has developed the Buffalo treadmill test, which helps identify very specifically um, a starting point for where somebody who's concussed can exercise. And McGill has also done some important work. So Isabelle Gagnon has a research group there that has explored active rehab approaches and the intervention as a clinician a physical therapy intervention at Montreal Children's Hospital, and at University of Quebec, Trois-Rivières. They've looked at using active rehab approaches using some balance work and some stretching. University of the Cincinnati Children's Hospital has also looked at active rehab and done some really great work in looking at whether doing an RCT as to whether active rehab versus standard care, which is the sort of not doing anything, it has been helpful. And then Holland Bloorview, I'm going to tell you a little bit about the work that we have done to date. So the work that we did at Holland Bloorview really came from some system gaps. So when I first started my postdoctoral work there in 2015, we didn't even have a concussion center. So we developed it, we got some funding and did get a concussion center, but we found that we had really long wait lists to get people in. And when you have a concussion, you really need information right away. When you think about most people recover within a month, if you don't get the information, it's kind of hard. And we also found that people weren't getting any information and then they weren't getting better because they were doing things that weren't helpful. So having a wait list was a problem. We also found that when people finished our program, we didn't have anywhere to send them if they still needed care. And so we found that we really needed more clinicians who were trained in best practices in concussion care. And we also found that there was very little research to guide what we were doing. Unfortunately, there was also limited funding, so we really weren't sure how we were going to accomplish what we wanted to when there wasn't any money. Fortunately, Scotiabank stepped up and provided us with some funds to start a student-led clinic. And we started a student-led clinic in concussion care to address all of those gaps that I just mentioned. So we trained interprofessional students. Mainly the students were from physio, OT, and our Masters of Professional Kinesiology program at U of T. And we trained them up to run Concussion in U, which is an education and support program for kids with their concussions and their families. So people could, if you had a concussion, you could call us and you could get this education session that same day if you wanted. We also involved the students in an intervention research program, which I'm going to tell you about, which was basically prescribing active rehab programs for kids and then monitoring those for 6 weeks. And we also had our students support other educational initiatives like going out and talking to sports groups or schools, training coaches, that kind of thing about best practices in concussion care. So our program started with, or the active rehab program started with education and support. So families would come to our Concussion in U program. And so you can get all of these resources on our website, and I've listed it here. Just go to hollandbloorview.ca and you can look for Concussion in U within the site. You can find all of this information. There's a handbook that's downloadable. But the education topics that we covered were, sort of what is a concussion, energy conservation, sleep hygiene. We gave them some self-management tools, like some calendars and handouts that they could, interactive handouts that they could work with. We gave them return to school and sport guidelines. We talked about nutrition and hydration, and we also talked about relaxation strategies. Now, most people could recover with getting that information. Now, the 30% or so that continued to have symptoms beyond 1 month were invited to participate in our active rehab study. And our students worked together to complete 11 different assessments. And these included things like getting some demographic information, taking a history, doing a symptom inventory, some physical strength assessments, balance assessments, the vestibular ocular motor screening assessment. We also assessed for mood using the Beck Youth Inventory, and we looked at their activities using the Canadian Occupational Performance Measure. And we took all that information, the students did, and they worked together and they developed programs for the kids. So these programs included three things. They included an aerobic component. So this was either riding a stationary bike or walking. And in clinic, when kids came to the clinic, the students put them on a stationary bike or a treadmill, and they put a heart rate monitor on them, and they had them work between 50 to 60% of their maximal heart rate based on their age, or at a perceived exertion rate of 4 out of 10. And we plunked them on, and then they walked or they rode their bike until their symptoms started to come on, at which time we stopped, and that became the basis of where they started their program. So that was their aerobic prescription. Then we also had them do sport coordination drills, and these were developed, again, the students developed these in conjunction with the kids in relation to whatever sport they were interested in. So whether it was hockey or gymnastics, horseback riding, we had students that were into musical theater. So it depended what activities the kids were most interested in, and we developed coordination or balance drills that were specific to their interests, but also their assessment results. And the kids here participated in sport drills for up to 10 minutes, again, at 50 to 60% of their maximal heart rate. And then we also included relaxation exercises as part of the program. So the kids were, again, the students work with them to figure out like what they could do and what they would enjoy doing for up to 5 minutes. So many kids enjoyed using apps. There are all kinds of different apps, so the students would help them find an app, or some would just like to listen to music. So they figured out in conjunction with the student what would work best. And one of the reasons that we encourage kids to do relaxation is that it's an exercise that they could do no matter how symptomatic they might be feeling. So that relaxation component was an important part of the program. So now I want to just shift gears a bit to tell you about what we learned. We had over 90 kids participate in active rehab programs through our student-led clinic, and we had more than 1,100 people come through our educational programs. But I thought what I'd share today was what we learned specifically about the active rehab interventions. So, and the three things I want to talk about are that I'm hoping that you'll find as interesting as we did, are what activities are youth concerned about and how does active rehab impact these? What aspects of the active rehab intervention are most important to kids and families? And how does active rehab impact mental health? So the first thing I'll talk about is what activities are youth concerned about? This is a paper that you can look up if you're interested on this topic. But what we did was basically we collected all the information that we had from the kids using the Canadian Occupational Performance Measure. And we found that many of the activities were in the green at the top of the screen. You can see many of the activities were related to leisure activities. So the sports obviously is a big one here. Productivity or school related things. I think for many people, this was a surprising result that school related activities were quite important. In fact, they were at least as important as sports. And here we see they're actually a little bit even more. So I think that was a big finding for us that concussion is not all about sports. It's also about school and other things too. As you can see, social related leisure was pretty important, as was concerns about screen time and sleeping and even showering. So there's a lot of different things that kids are involved in that we need to think about when we're thinking about interventions for concussion. The other thing I'll just point out here is that we also looked at change in occupational performance and satisfaction with that performance. And we looked at correlations between these changes and symptoms. And one of the things that we found was that, as you would expect, as symptoms improved or symptoms went down, that their performance increased and their satisfaction with performance also increased. So that kind of makes sense. As kids felt better, they were able to do more. So the next question we wanted to tackle was, what aspects of the rehab intervention were important to youth and parents? Because this active rehab intervention is considered a complex intervention. So, it involved an aerobic component, it involved an educational component, it involved coordination, and it involved relaxation. So it's considered what is known as a complex intervention. So we wanted to explore, like, what were the key ingredients? Like, what were the most important things that kids liked in the program? What was most important to them? What did they find most valuable? And we wanted to know the same thing from the parents' perspectives. And interesting, this is what we found. So you can read the article if you want more details. But for the kids, we were sort of expecting that the exercises were going to be the most important thing. But the kids told us that energy conservation and education was actually the most important thing. So learning how to balance activity and rest. Returning to school and sport information was also important, but it wasn't the most important. Sleep hygiene was also important, as was relaxation. For parents, parents found that the general information about concussion was the most important, along with signs and symptoms, and information about return to school and sport. So the sort of the take-home message that I would share from this particular study is that education and support is very important to youth and to parents, and these are the topics that people found most helpful. So just along with that, I wanted to share with you some of what we taught people um, related to these topics. So energy management, we talked about the 4 Ps, so prioritizing, planning, pacing, and positioning. And, I think most clinicians can figure out ways to adapt this information to meet the needs of their clients. But one of the things that we did was we used analogies with a gas tank for parents and a cell phone battery for kids. And I have to tell you, when we started our program, we just used the gas tank analogy. And the student said to us, little kids aren't going to relate to this. We need to change this to a cell phone battery. So the students actually are the ones that added the cell phone battery component. But the idea here is that what we want to convey is that everything we do in our day uses some kind of fuel, and that when you have a concussion, you need to kind of conserve that fuel or use it really wisely. And so the goal is to kind of keep your battery charged. So that's the analogy that we use, but there's lots of analogies out there. I recently saw one that was it was a pot of boiling water, and you need to kind of keep that at a nice simmer as opposed to like the pot boiling over when you're doing too much. And that was kind of a neat one. Anyway, so those are the analogies that we used. In terms of return to play school guidelines, there's a lot of information out there, and a lot of the information isn't accurate. So it's really important when you're giving return to play or school guidelines that you use ones that are up to date. We typically used the Canadian guideline on concussion in sport, which is located at Parachute Canada. And there's also School First concussion.ca that has really good information about returning to school. In terms of sleep, we provided general information about sleep tips to recover. So trying to wake up and go to bed at the same time every day, which is surprisingly for many kids, having a bedtime routine was absent. And so, so that establishing a sleep-wake cycle was really important, particularly teenagers who tend to stay up all night and then want to sleep all day. So those were kind of important things. A few other things that we learned were, the caffeine and alcohol, limiting naps, because a lot of them would tend to nap during the day because they were tired, and unplugging the technology at least an hour before bedtime. And another thing we actually learned from the kids is that a lot of them sleep with their pets, and the pets while they're also a comfort, they also tend to move around at night and can sometimes disrupt sleep. So it's just something to think about. And other people liked using white noise devices. So our next question was, how does active rehab impact mental health? And so we did a sort of a more in-depth study here looking at mood changes in kids after they finished our 6-week active rehab program. So as we discussed earlier, kids with pre-existing mental health issues um, can actually, they take longer to recover, and they can actually get worse because of this lack of participation in meaningful activity. So kids that, are really engaged in sport and no longer have that role can get, very, very sad about that. A study by Michael Ellis at University of Manitoba indicated that almost 12% received a new mental health diagnosis post-concussion. And as I've mentioned before, that pre-existing mental health variables are a very robust predictor of outcome. So it's really important to address mental health as part of holistic concussion care. So we wanted to explore, how active rehab helped to change mood in kids with concussion, and we also wanted to look at whether there were sex differences in these in mood changes. So we took all the kids that participated in our active rehab program, and we pulled out two of the measures. The study I'm going to tell you about is just where we pulled out two measures. One was the Beck Youth Inventory. Some of you may use this in your work already, but the Beck Youth Inventories have 5 subscales. So they look at depression, anxiety, anger, disruptive behavior, and self-concept. And the kids filled out those, and the parents completed something called the Child Behavior Checklist, or the CBCL. So our program was this. So we did the comprehensive assessment at what we called week 0. So that was before they started the active rehab program. Then they had 6 weeks of the active rehab program. And then they came in for reassessment at the end of that 6 weeks. And we did a bunch of statistical analyses to get our results. But I also want to say we had a number of kids that dropped out, and we did what's called a loss to follow-up analysis. So I think there were 8 of them that dropped out. And I'll talk about that in just a minute. In terms of our results, we had 40 kids that completed the program in this study, and 8 of them we also had 8 kids that dropped out. There were 65% were female and 35% were male. And the average time since injury was about 5 months. And there were a variety of pre-injury diagnoses. Now, to let you know what we found was that we found that there were significant changes in anxiety, anger, and disruptive behavior. And we also found a significant correlation between sex and the anger subscale. And we did regression modeling on that to look at that relationship a little bit more, and found that girls experienced greater reductions in anger than boys post-intervention. Now, the reason that I mentioned this loss to follow-up analysis is that one of the things that we found was that we found significantly lower self-concept in the kids in the loss to follow-up group. But there were no other difference in any of the other measures that we did. So that tells us a couple of things. So in the study overall, I guess what I want to, the take-home messages here are that positive changes were found in anxiety and anger following a 6-week active rehab program, and that this was evident in both boys and girls, but girls had significantly lower scores on the anger inventory than boys. We also found that parents reported significant improvements in mood across the board. And this loss to follow-up group had lower self-confidence pre-intervention. So these have a number of important implications for practice. So, active rehab may support move improvements in youth recovering from concussion. So we think that active rehab in general is really helpful to kids. But we also found that, um, and many people think about, anxiety when it comes to concussion, but these kids have a lot of anger. And so we felt that because of our results with anger being reduced in active rehab, we thought that clinicians might want to think about anger management as part of a comprehensive concussion program for kids. And then importantly, youth who drop out of studies may be at particular risk. So we have to think about, like, how are we going to engage those kids, and what are the reasons for why those kids couldn't stay engaged in the active rehab program. And finally, one of the biggest things we learned from the work that we've done is that education is a really important component of um, uh, concussion management. And we also found that our students were really, really outstanding at delivering education. So there's a huge role that students can play in concussion management in terms of this education component. So just to kind of wrap up my talk, and we can move into the question and answers if people have questions, is that education and support in concussion really matter, and it's a really, really important part of concussion recovery. That active rehab programs involving exercise, education and support, coordination, relaxation are really helpful for recovery and particularly for mental health. And that health professional students can make a huge contribution to concussion management by providing education and support services and being supported to assess and prescribe and monitor active rehab programs. And I'm just going to share some references, just so these are in the recording, but these are some references that were presented today, and some resources that people might find useful, some up-to-date resources. Here I've listed Holland Bloorview as some excellent resources for kids with concussion. Sunnybrook Health Science Center has an excellent MTBI concussion handbook for adults. The Neurology Center of Toronto also has some really great handouts. Here are some of the most sort of up-to-date guidelines for concussion recovery and concussion care. And at this point, I will say thank you and have a few minutes for questions.
Thank you, Anne, so much. That was fantastic. I know that there's a question in the chat from
Somehow
Becky.
I've lost the chat box here, so I may actually stop sharing my screen. Oh, there we go.
Absolutely.
Okay, hold on, there's my chat.
So it was from Becky, and she says, how do you choose apps that promote relaxation rather than overstimulation?
Yeah, that's a great question. So, interestingly, there's been, I will dispel the screen myth. So, for some people, the pixels, like, the screens are made of rapidly moving pixels. And for some people, that's really difficult. But for by far the majority of people recovering from concussion, they don't need to worry about screens. What they need to worry about is the time spent on screens. So when we're spending time on screens, we're concentrating, and so we're spending a lot of attentional resources on whatever it is we're doing on the screen. So the time you spend on the screen and what you're doing on the screen is kind of more important, or is something that's very important to think about. Um, the app, so interesting, we did to figure out what apps to use. We actually surveyed kids and we surveyed students to see what apps they liked. By far and away, the biggest one that came back was Headspace. It's a you have to pay for it. I think you might be able to get the first month free. I'm not sure if that's changed, but Headspace was one that a lot of kids really liked. but there are also free apps, and it's really, honestly, what we found is it's finding ones that work for you, because not everybody enjoys the same thing. So there's some apps where they have like a circle that starts out really small, and as you breathe in, the circle gets bigger, and as you breathe out, it gets smaller. Some kids really like that, but others, it would drive them um, wild. So it's really a matter of trying something, and if it doesn't work, knowing that you can try something else. So I think that's sort of more the key, is that finding out, like, what do you like to do? Some kids just like to lie there and do a visualization exercise where they, pictured themselves lying in their or being in their happy place, and going through, what does their happy place physically look like? What does it feel like? What do they smell? What do they hear? So going through all of those. Um, I hope that helps.
Thank you, Anne. Yeah, and if
You're
anyone would
welcome.
like to put their video on, we'd love to see you, or take yourself off mute and have a chat. We would love that. Again, I want to apologize to everyone for the wrong link being sent out today. So I do apologize again, and I'll open up the floor if there's any questions.
I'm curious to know. Oh, sorry. Go ahead, Mike.
Oh, sorry, and I just had a quick question for you, and I noticed that kind of toward the beginning of your talk, you'd mentioned that there was some guidelines that are being circulated that actually have the wrong information, or potentially harmful information in terms of management of concussion in youth. Are there myths that maybe want to make everyone aware of, or things that concussion with youth really shouldn't be doing that might be part of those guidelines that are being circulated?
Yeah. So the dark room. You do not have to go in a dark room. Um, don't have to go in a dark room. Um, oh, so that's one of them. But the second one is this idea of active rehab. People hear like, oh, you can exercise after concussion, and that's true. But, and I should have stressed this in my talk, is that you exercising after concussion in any way really needs to be monitored by a health professional that knows what they're doing. There was a study done at Mount Sinai in Toronto with adults where, and it was a great study, where they, told half the group when they left emergency, you can do some exercise, you can walk, you can do some gentle exercise, and they told the other group don't do anything, and neither group improved. So there was no difference in either group. So they and my take on that was that they didn't have ongoing supervision, and you really need it. And that's why what we found out was the education and support pieces were really important. And so people need both. They can't, and my colleagues and I did a lot of this while we were doing the study that went on for 3 years. We were kind of thinking, is it the education? Some days we'd think, oh yeah, it was the education. And other days we'd be thinking, oh no, it's the exercise. But we kind of came to the conclusion, and based on all the research we were doing, that it's really both. And the program has to include both to be effective. I'm trying to think if there were any other sort of myths. Oh, the other one about sleep, after you have a concussion, you have to be woken up every hour or whatever. That's actually, no, you don't, that's not true. You need sleep after a concussion. And so sleep is really important. So that's another myth. There aren't any real supplements that are known to help. The biggest thing, when I say that, in that, we don't have research to support it. And so when, as a healthcare professional, a regulated healthcare professional, it's my job to promote evidence-based care and evidence-based interventions. So at this time, we don't know anything really about nutritional supplements or specific devices. There's some really cool emerging technology coming from this company Neurotech Connects, and so I'm anxiously waiting to see what some of their their work is going to show. Using sort of neuromodulation to impact activity and recovery, and they're testing some of this on one of the Humboldt Bronco bus crash survivors, and many other people. But it would be very interesting to see what comes of this.
Thank you. I think you were going to ask a question of the other people who are here.
Yeah, I would. I mean, I was just curious to see what people were doing, or if any of this resonated with people, or maybe people were just here just to hear. But I'm just curious to hear what people are doing. If anybody wants to share, maybe not. Everybody's getting anxious to go back to work, probably.
Hi, it's Michelle. Well, I was here mostly to just hear what you have to say. I work primarily with seniors, but a lot of them fall and a lot of them get concussion. So just to encourage them to exercise gently and to not just shut down afterwards. It's been really helpful. Thank you.
Yeah, thanks, Michelle. I'm really glad you raised that, because this is actually another area I'm very interested in. And there are, I think we can. Well, I think we can use a lot of the things we've observed in kids and start to look at these in older adults. We noticed, for example, like balance issues, vision issues. So sometimes we've noticed, like when we'd have kids doing the sport coordination drill, we would uncover vision issues that had gone previously undiagnosed. And so the vision issues, again, we know that vision and balance are really important in falls and preventing falls. So, so I think some of the work, like it's important to look at some of those things in older adults, like the vision and the balance pieces. And yes, they need to keep moving, right? So I think that's sort of you're going to hear more about concussion treatment in older adults in the future. Thanks for joining today.
Thanks, Anne. I think it's really important to get this information out to the doctors as well. My mom just got a concussion and they're like, sit in a dark room, wear sunglasses. And I was like, oh, so this is interesting. So thank you for that. And just to let everyone know, I will put all of the resources on our website as well, so people can access them easily.
Yeah, and I think, thanks for sharing that, Jen. This is something, and again, this is why we had our students do a ton of community outreach, because we know from knowledge translation research that it takes like 17 years for research knowledge to make it into clinical practice. And so, so what you just mentioned is hugely important. So I know my colleague Nick Reed spends a ton of his time doing just that, is trying to get word out to get rid of the dark room, bedroom jail sunglasses. And you think about, like, when you think about that logically, you think about, like, if you go to a movie theater in the middle of the day and then you leave that movie theater, like you've been in the dark for 2 hours, and that sensory overload that you get when you come out, that's exactly what's going to happen to somebody with concussion who's been sitting in a dark room and hasn't had that stimulation. They are going to be overwhelmed and overloaded. So that's why that energy management piece and doing a little bit and balancing your activities with rest is really, really important.
Thank you.
And for adults, I would highly recommend checking out that Sunnybrook concussion MTBI handbook. It's excellent.
Any other questions?
Well, thanks so much, everyone, for having me. I was delighted to be here today.
Great. Again, Anne, Dr. Anne, I want to say thank you for joining us today. And this was a wonderful session. And we look forward to hearing more about more projects that you plan down the road. And yeah, so thank you very much.
Thanks so much. Have a great afternoon, everyone.
Thank you.